Hi, I'm Dr. Justin Berlin with Delta Chiropractic. Today we're talking about how does our practice, Delta Chiropractic, work to eliminate headaches. When you first present into the office, you're going to show up here, our front desk area here. The ladies will help get you checked in. They'll help you fill out your new patient paperwork if you haven't done it online already. And then after that, we're going to have you walk back to our exam room. And in the exam room, we're going to go over a case history. Is there anything in that case history that may be pointing to headaches, of the such, and we're going to follow through with an x-ray. I'm going to hand you over to Dr. Mark. He's going to show you where that happens in our practice and take you on a little tour of our office.
So when all the paperwork is done, we're ready to start the exam and take the x-rays. I'll walk you back through here, and then with the paperwork, we take the time to analyze all of that, come up with some questions, and come up with some of the right solutions of stuff we're going to be, looking for in the exam and x-rays based on what people are dealing with specifically. That helps us do a couple things, make sure we have the right questions to ask and the right solutions we're looking for. So right in here is the exam room. And here we'll just talk about the case history, which just means a couple things. How long has something like this been going on? Talk about maybe different injuries and how it's affecting your leg specifically, and how we can start building goals and to make steps towards that. One big thing we talk about is we like to qualify pain in any case. And a lot of time with headaches, we always say that the pain is not the problem. The pain is just a symptom of the problem. And so through a thorough exam, which includes stuff like a postural analysis, different range and motion testing, orthopedic testing, functional joint and muscle testing as well. So all of that helps build a case of getting down to the root cause of why this pain is happening. And then after that, we'll take an x-ray. So we'll walk over into the other room here, where we have our digital x-ray suite, which is just right in here. And so what we'll do is we'll take at your neck and your lower back a front view and a side view, so we can see what your spine looks like on the inside. From the front view, we'll get to see alignment, how well the vertebrae stack right on top of each other. And then from the side, we'll get to see the curves of your spine. Each time we're looking for 3 45-degree curves from the side, and this helps us look at a couple things, say, hey, are you normal? And if you're not normal, how is this impacting and contributing to headaches specifically? So that will be it for the exam, and that'll be a large part of day one. And we'll walk back up front here. And so after day one, we like to take the time to analyze the x-rays, build a plan, and help you reach your goals. We're always asking patients what are their goals of having here, and how we can best suit that and help serve them. So one of the things we do here is we have this room here. When we get patients back, when we start treatment, this room is a big proponent of that. The things we're always recommending patients is more active care, having people take more of an active role in their health. And so stuff like our cervical traction to help with the neck curve, and our vibe plates to help with posture and balance, and many other things are part of what our treatments, combined with the chiropractic adjustment, help push people towards their goals, whatever they may be. The next part of the office is our adjusting rooms here. So we have 4 adjusting rooms right now to help keep things moving, keep patients in and out, keep down the time visits. But on the end of day one, we'll walk you back up, and I'll pass you off to Dr. Justin. We'll talk about the day 2.
So like Dr. Mark said, once we have a good understanding of where your headaches are coming from, right? We don't simply want to treat the symptom, but we've done a thorough case history, we've done the testing, we've taken the x-ray. Definitely the 2 big things that we look at that the x-rays show us are the neck curve, the alignment of the first vertebra. Those are very easy to see on the x-ray, and that's why we do the traction room the vibe plate, and then of course the adjustment to create the realignment. So day number 2 is an explanation of specifically what are we going to do for you. What is your x-ray? Is it maybe lifestyle modification? Are we sitting at our desk hunched over too long? Do we need to reset our posture? What things in your life that you can change along with the chiropractic adjusting and the corrective exercises that we're going to give you. So on day 2, we do a report of findings. We lay that out for you. We lay a plan. We go over insurance, any finances, and then also give you your first adjustment. So once that is done, we're going to walk you back up front here. We're going to let you check out with the office staff, schedule your next visit, and then really you know, moving forward from there, the adjustments are a lot shorter, the office visits a lot shorter, and we lay out a game plan for you and exactly how we're going to correct the problem for good, eliminate the headaches for good. So we don't have to live right with our headaches. We can be headache-free from now on. So that's a tour of our office. We'd love to have you come on in. Give us a call. Phone number is on the website. There's a scheduler on the website, but we'd love to start working on your headaches and eliminate them for good. Thanks for taking a tour of Delta Chiropractic, and let us know how we can help you eliminate headaches.